Each day, the crises multiply. Each day, their solution grows more difficult. The tide of events has been running out, and time has not been our friend.
We can now count in decades how long we've been struggling with this challenge of assuring access to decent health care for America's children. It would seem inarguable that all children should have a decent place to live, a good education, and health care. But in our cities and rural communities, the failure to meet these challenges remains obvious and painful. So there is a crisis, a very persistent crisis, and the country keeps seeming to lose interest. And that's why we can't and we won't give up. The mobile units of the Children's Health Fund were created with a simple goal: to bring doctors and nurses to places where families and children struggle to find health care. From the inner cities of New York and Los Angeles to the back roads of Las Cruces, New Mexico and Arkansas, the Children's Health Fund is there. And now, 19 years after it began, the Children's Health Fund spans 21 sites across the country. Lots of children and their families have been cared for by many caring people.
Listen to your belly.
See me now, you would never think to wonder.
But it hasn't been all business as usual. The mobile units, it seemed, had the ability to provide a rapid response to public health crises. We realized this when we came to provide health care for thousands of victims of Category 5 Hurricane Andrew, which smashed into South Florida in 1992.
I think my soul was stuck in amber.
And we did it again in 2001, dispatching units and medical teams to Ground Zero after the terror attacks of 9/11.
Now I'm gone.
And then came Katrina, 100,000 square miles of devastation, more than 1.5 million displaced people. And as Paul Simon put it from the rubble in Biloxi, Mississippi, this is a disaster of biblical proportions.
I'll be gone, yeah.
Paul and Karen Redlener, along with our national network and the many supporters of the Children's Health Fund, understood we needed to help. Medical and support staff from 13 Children's Health Fund sites came to the Gulf, where they worked side by side with local medical teams and disaster response officials. And since Katrina, more than 15,000 health and mental health encounters have been provided by our teams. And in fact, we're there to stay. The Children's Health Fund created 3 permanent programs using 5 new mobile medical units in partnerships with Family Health Center in Mississippi and with Tulane and LSU medical schools in New Orleans and Baton Rouge, Louisiana. But we needed to know more about the conditions and the environment that were keeping children at risk. So Operation Assist was created by the Children's Health Fund in partnership with the Mailman School of Public Health at Columbia University. We fielded public health research teams to assess the environmental contaminations of mold and other toxins. We conducted a comprehensive face-to-face assessment of health and mental health conditions among the evacuees. And the studies confirmed our worst fears. Massive health problems, and kids not going to school. And it seems we're now facing what amounts to a second disaster in Katrina's wake for the children in the Gulf. And the 2006 hurricane season has just begun. The CHF is as comfortable in the halls of the Capitol as in the hollows of West Virginia. So we go to Washington to remind elected officials about their responsibility to America's families.
You have to embrace in this Capitol and make sure
The children in the Gulf, like children across the country, are America's lifeline to the future. I think we understand, the Children's Health Fund and its supporters, that this means more than just words. Really, it's about an enduring commitment to caring for our children.
I'm gonna watch you shine, gonna watch you grow, gonna paint a sign so you'll always know, as long as 1 and 1 is 2. There could never be a father love his daughter more than I love you. If you leap awake in the mirror of a bad dream, and for a fraction of a second you can't remember where you are, just open your window and follow your memory upstream to the meadow in the mountain where we counted every falling star. I believe the light that shines on you will shine on you forever. And though I can't guarantee there's nothing scary hiding under your bed, I'm gonna stand guard like a postcard of a golden retriever, and never leave till I leave you with a sweet dream.